Okay, so my name is Ashley Calvo-Rodriguez, and I'm from the Todu Guam Foundation. We're a nonprofit organization based in Guam, and so I'm really thankful to COA for kind of laying the groundwork and laying the landscape of the different parts of the Pacific Islands. And so Guam is an island in Micronesia, and the population that we service are primarily people from Guam and then also other Micronesians. And so we're a locally and nationally recognized 501c3 nonprofit organization. And our organization's name, Todu, is a native Chamorro word meaning all, everything, or entire. And so our goal as an organization is to provide healthcare for Todu Guam. And our mission statement is to address health disparities and promote health equity on Guam by providing access to basic healthcare, support, and education without restrictions to the underserved population. And so a little bit more history of our organization is we started in 2016, and initially we had only worked on a volunteer basis, and we had a lot of volunteer doctors and nurses who worked together, and we had a mobile clinic which we still bring out into the community, into the hard to reach areas, and volunteers would go to provide free healthcare services to this community. And so over time we learned that there were a lot of restrictions and a lot of gaps in services in providing access to care, and one of the biggest challenges was education. And so our work with the T mini grant has really helped us promote TB education, as well as work with our partners to grow and expand the services that we can provide. And so our TB Elimination Alliance program objectives for this year was to promote community engagement through education, and also provide clinical and non-clinical provider education and quality improvement and evaluation. And so our role in the T mini grant is very unique in the sense that it was a symbiotic relationship with the local Guam TB program. And so all of the work that we did in the T mini grant really relied on our partnership with our public health partners, and that really showed to the success that we had with this mini grant. And so going right into the lessons learned, we developed a trust with the Guam Public Health TB program, and we had a shared objective from the beginning to increase TB awareness and education in the community, because education and outreach in the hard to reach areas seem to be one of the greatest challenges. While public health has the technical support and they have many of the resources, our organization as a nonprofit and being outside of the government allowed us to have a lot more flexibility, and we were able to manage expectations faster. So a lot of times, many of you are probably aware that there are many challenges with the government, such as procurement and time constraints. They work only from Monday to Friday, 8 to 5. And so our organization, our model for an organization, not just with the TB program, but with all of our other programs, is to work on weekends and after work, and also not just stay in the community health centers or in centralized areas, but we would bring our mobile clinic and our team of volunteers and outreach educators to the hard to reach areas where these populations who are greatest affected by TB were living. And so both our organization, the Todu Guam Foundation, and the Guam TB program had shared ownership of the project. And whenever our organization needed technical support, or we needed support through our clinic, they were able to come out and provide either manpower, supplies, assistance, and then vice versa. If they had contacts or they had clients who needed to have some TB education, and maybe they had one patient who was a contact, but they were a part of a larger community, they could tell us, hey, maybe you guys can go and give an outreach with education to this organization. And that's kind of how our partnership had worked. And then we also managed to work as a team in the grassroots engagement. And so this is one of the few times where public health partners were able to have a solidified and formal partnership with a nonprofit organization, and they would come and join us on our weekend outreaches, because while they see our organization out there providing education, they can also see those people from public health who would call them, on the weekday and say, hey, you are a contact for TB. We need you to come into the clinic and do testing. So our organization allowed for public health to join us. And while we have the support and the relationships in the community, they were also able to garner a lot more cooperation from that community to come into the clinic. And our organization's adaptability to the situations in the community allowed us to be a lot more responsive to strategies. So overall, it was a really good and prosperous relationship. And I think that the 100% support that we had from the TB program really helped our organization become successful in the execution of this project. And so I'll just open up for questions now.